you could click maybe the screen capture treat. Maybe that would pop up there.
Okay. I think we are actually recording. Okay. So, start.
It's like a hair follicle with a bunch of beaded hyphae in the middle. Looks like an endothrix.
Yeah. So they're round spores, chains of spores, and so a large spore endothrix, which is what this is likely to be.
Large spore endothrix. Is it T. verrucosum? T. rubrum?
Well, rubrum does it. So things like Miyake's will be endothrix, and it's a reasonable size spore. But your classic large spore endothrix is tonsorians. Right? Violation does it too, but in the U.S. it's mainly tonsorians. So tonsorians, fluorescent or not?
Not fluorescent.
Not fluorescent, and is your typical sebderm like tinea capitis in a African American child. Can also be inflammatory carrion, right? But it's commonly more sebderm like in the scalp. It was an African organism. So in African American scalps, it's less inflammatory because they're more adapted to live together. In Caucasian scalps, it's likely to be more inflammatory just because HLA type, etc. It's not as well adapted to coexist. And then what if it were large spore ectothrix all on the outside?
M. canis?
No, that large spore, that's verrucosum. Right, cracks into the auger, but we don't culture them in house anymore. But verrucosum, cattle farmers, right? Cattle farmers, highly inflammatory because the zoonotic are all highly inflammatory. Geophilic and zoonotic are highly inflammatory. Face of a farmer, typically cattle farmer, for verrucosum, large spore ecto. Small spore ecto, those are your fluorescent, right? And which are those?
Schalini.
Schindleinii is weakly fluorescent, but that's a hyphal endothrix. The small spore ecto, or cats and dogs fight outside.
Okay.
Right. Canis hodwini ferruginum distortum. Distortum is a weird Australian variant of Canis. Okay, and we're not entomologists, but you should have some familiarity with them. So these are just fillers, and we'll just look at them, right? So what is this one? Amblyomma americanum, excellent. Okay, Lone Star tick, female. Female always has a small scutum, so the abdomen can engorge because it's the female that sucks blood and attaches. And the carries southern Lyme, the starry southern rash illness, and carries ehrlichiosis, and can carry Rocky Mountain spotted fever. Okay, bed bugs. You probably should recognize them. In New York, they'd be brought in at least 10 a week with a question, is this bed bug or something else, because the patient brings it in. New York is the land of bed bugs, but here, you see it everywhere. In Danville, PA, we had them crawl out of the sleeve of the patient onto the desktop in the office. So you can see it everywhere. And I've heard a couple of medical centers, they had problems with them infesting the wheelchairs in the hospital. So the patient's sitting in the wheelchair and the bed bugs are getting them. So, you just want to recognize they're hemiptera. So hemiptera usually have overlapping wings in the center that don't cover the periphery of the body. But in a bed bug, only the sclerotic proximal portion exists. There's no membranous portion of the wing, so they can't actually fly, right? So they're the hemipterids that can't fly. They have vestigial wings. And they're about the size of a tick. So, that's them on the body, feeding. Okay, what's your thought?
Mostly inflammatory Ebola. Think about
Tense or non-tense?
tense, so like BP type things.
Yeah,
About
so
arthropods.
BP would be high, but
Bullous
so would bullous arthropod, right? We just looked at arthropods. Remember, bullous arthropod can give you a false positive DIF, especially scabies. Right? Black widow spider has the red hourglass on the abdomen. Blister beetles will come in. They'll come into hospitals at night with open windows, but they're widespread, and it's what they contain cantharidin, right? So they produce a cantharidin-like blister. Okay, how about this?
So if you think of like pubic lice, if you think of like scabies,
So scabies, the nodules are usually where?
scrotum.
And glands. Right, so in scabies, usually glands and scrotum, nodules spare the shaft. In this case, it's shaft. They are somewhat macular and they're pigmented, so you suspect. Anybody? Boenoid papulosis. Correct. So as opposed to HPV type 6, which tends to be a raised cauliflower-like lesion, the high-risk Bowen's-producing HPV types tend to be macular and pigmented. They're flatter, sessile, and pigmented. Not necessarily macular, but they can be. And they're brown to gray variants. So all this gray stuff probably is Bowen's as well. The term Boenoid papulosis was coined, I believe, by Dr. Helwig and Graham at AFIP. At the time, the standard therapy for Bowen's on the penis was excision, and the standard therapy for Bowen's on the vulva was radical vulvectomy. And so they coined the term to get people to stop doing radical vulvectomy in women who had venereal warts with atypia. And now Bowen's on the vulva is not treated that with what was probably overly aggressive surgery at that time.
What
Okay.
do you like for, if you're...
Oh, so how am I going to treat it?
Yeah.
Yeah, so the problem is, what if it's just these guys, you can freeze them, right?
Sure.
But what if all of this is Bowen's? I'm a 5FU guy. 5-fluorouracil is, there are tons of data for it on shaft, as well as there's the most data for urethra as well. And the data support, it probably has a lower incidence of urethral stricture than surgical modalities trying to treat them. And the only key to it is don't get it on the scrotum, right? Because the scrotal skin reacts differently and takes months to heal often. So don't get it on the scrotum. And if you look at the ventral surface of the penis, there is a triangle of scrotal skin that goes, half or whatever up the ventral surface. patients who are putting it on the entire, who aren't instructed otherwise, come in with this perfect triangle erosion, painful. So you just, the mechanics of how to are a little bit important.
For a patient with VA, he was using biofeal on his scalp, and mine wasn't all there, and he had some severe.
Well, people go to the restroom, right? And you see that with all sorts of things. Why does ORF occur so commonly in genital areas? Because people are at the fair showing their animals, and there's a porta potty, and there's no sink, right? So it's, and 5FU travels pretty much the same way. So, okay, what's this one? Brown recluse. So the fiddleback pattern, and it has 3 pairs of eyes instead of 8 pairs of eyes. And cat flea, which is our usual flea on cats and dogs. It's a combed flea, so it has the combs, genital and pronotal combs. And so again, that's, look, cat versus dog, you count notches and the sloping of the head, but no one cares about that part. Important because they are vectors of disease. They are probably the major vector of cat scratch disease, which is not the scratch of a cat, but the bite of a flea. They carry bacillary angiomatosis, and they also carry endemic typhus in the U.S. They're probably the major vector. Texas is kind of the hot spot for endemic typhus, and it's cat flea on opossums. And then they get on your cat or dog and come into the house. And so, okay. You think it's a centipede? Well done. How would you have thought of that? So centipede bites. The key is there are many large centipedes, and kids come in crying and saying they were bitten by a snake. The question is, do you do antivenom or not? Centipede bites tend to be, you get pain and paresthesia, but they're benign. There's no systemic toxicity, unlike snake bites. So the jaws of the centipede, the way they come together, it makes a chevron-shaped bite as opposed to the twin puncture marks of a snake. So usually you can look at the wound and tell which one it was. Important because of the risk of serum sickness with snakebite treatment. Right? Centroides sculpturatus, the southwest mainly. It's the most lethal potential. You don't usually die from it. I mean, there have been very few reports in small children of death. The red scorpions in India and South America are much worse in terms of lethal potential. But this is one in the U.S. that is a potential problem, and this is the related Centroides vittatus, which is all over the South. I mean, they come up. We have Centroides invagivus up into Huntsville, Alabama, and it's sort of the whole southern tier of the U.S. has them, but they're not real bad, other than just a sting. Coletiella, you should probably recognize. It's so-called walking dandruff in dogs, cats, and rabbits. And so the dog, cat, or rabbit has dandruff, and the human has bullous dermatosis. And again, it's been described as having false positive IF, just like scabies can. Okay, these are probably, could be fire ants. Fire ants are often pustular, though. Chigger bites would be another thing. Fire ants tend to get you where the elastic ends. Chiggers go under the elastic. So chiggers tend to be sort of like under the elastic band, under the sock band. And chiggers in Asia vector for Tsutsugamushi fever, not particularly disease vector in the U.S. right now. Okay.
It's like condyloma.
Yeah, so condyloma and perianal. So the first question is treatment, and second question is risk. So do these ever go on to cancer?
They could.
So verrucous carcinoma is 6 and 11, right? Is the quote low risk types. The other thing is people usually don't have just one type, right? So they could also have higher risk type. If this patient is, especially if the patient is homosexual male, or men who have sex with men, I guess is the current term, then anal paps are just as a woman would get a pap smear, they should have a pap smear, because the risk of anal carcinoma and metastasis from anal carcinoma is really significant. So, especially in the HIV population, that's important to reduce the risk of morbidity and mortality. In terms of treatment, individual ones can be shaved or snipped. Imiquimod is usually better tolerated than 5-FU in my experience. 5-FU you can use, but you're using it in more of a short pulse fashion because of the inflammatory reaction that you get in that area. And then you can use both podophyllitoxin, which is Condylox, right? You can use as well. And things like TCA have been used also. You can, I've had refractory ones that you apply TCA first and then apply the podophyllitoxin, and you get a better effect. It just penetrates a little better. You have to be careful of the extent of podophyllitoxin you're using, because it is, otherwise you're giving systemic chemo. If you don't want to paint it on a large area.
But the imiquimod is at 16 weeks, or is it less than that?
So it's usually, again, multiple shorter cycles because of tolerability. The other thing I usually, for both urothroscopy and anoscopy, wait until you've cleared all the external ones so you're not seeding internally. Right. So again, just the diagnosis is not hard, but the mechanics of treatment take a little bit of knowledge. And then more typical condyloma, to contrast with the higher risk type that in comparison tend to be more sessile, more pigmented. Right? Okay, diagnosis?
It's like lice, maybe,
Yeah.
pubic area, maybe.
Exactly, pubic lice. And what patients with pubic lice have in common that I have seen over the years is they've usually been seen by several other physicians for pruritus, and the diagnosis wasn't made. They don't stay in the pubic area, so if someone has a hairy chest or if they're anywhere the body hair is, the lice will be. The other thing is very significant incidence of other venereal disease that was co-infection. So it is an indication to screen for other venereal disease. What is the current CDC recommendation for screening for HIV?
Everyone.
If you are a living, breathing human being, right, you qualify for screening, for initial screening, and then anything that suggests higher risk, and this qualifies, right? So they should always be offered at a minimum screening for syphilis, HIV, and gen probe or other molecular assay that does chlamydia and gonorrhea because of the risks of infertility. Okay, and then that's the crab louse, so you recognize it, and that's the crab louse. Very resistant to treatment because it has a very impermeable carapace. The mode of entry for most of our topicals are these respiratory spiracles, but it closes them off when it gets wet. So, which is why most of our topicals were lousy in their effects on lice, right? Permethrin was better because it had a residual effect, so when it opened, it was still around, but there's a lot of resistance now, right? Ivermectin is used off-label, and ivermectin, it's a blood-filled organism, right? It sucks blood, and so the ivermectin bypasses the chitin, and it ingests it, and so that gives another modality for treatment. There are benzyl alcohol-based treatments now. The way benzyl alcohol works is it stuns these open so it can't close it, and then the inert ingredients go in and it kills by asphyxiation.
Can you just shave off all the hair too?
Yeah, which is in days of yore, whenever tensions would rise in the Korean Peninsula, they would have pictures of the North Koreans shaving their heads for battle, I guess to make themselves look fierce. Historically, it's probably shaving your head for battle because you were going to get lice when you went into battle. So shaving is, remains an effective treatment. It has to be total body shaving, and to some people that's not an acceptable option. So, okay, what's this one? Cutaneous larval migrans, usually a dog hookworm. So it loses its way. It can't get to your lungs because it's not one for humans. Treatments. Ivermectin is commonly used. Albendazole still can be used. Thiabendazole can be used. Topical thiabendazole under occlusion can be used. Cryo has been used. The problem is the inflammatory reaction, being cell-mediated immunity, is 2 days behind the worm. So you don't know quite where it is. It's a twisty-turny path, so you can assume it's going straight ahead a centimeter, but you don't know that. So, which is why things like ivermectin were an advance in treatment. Okay, what are these?
Demodex.
Yeah, Demodex mites. Demodectic folliculitis is common, and you see all the mites. They're normal fauna, but they can overpopulate, and there are also some evidence that the folliculitis may not be the mites themselves, but organisms that the mites carry. So it's not do you have mites, but are your mites ill? Dermacenter ticks have eyes right there and there. They have festoons. They have deep pits, and they have an ornate decorated scutum. Important because they remain major vectors of Rocky Mountain spotted fever and Ehrlichia in the U.S. Also, tick paralysis. Dermacenter ticks tend to attach where? Upper body and scalp. They love the scalp. So amblyoma is waist down. Ixodes scapularis, where might that attach? Trunk, right? And then dermacenter are commonly head and neck. Tick paralysis in the United States has about a 14% mortality rate, often in children, and the tick is usually identified by the mortician. So we don't tend to see it in derm, but one of the differentials of Guillain-Barré is tick paralysis. And New England Journal had a riveting case report. It's this young girl with refractory Guillain-Barré, and during her intubation, a medical student reading a spiral-bound differential diagnosis book looks through her scalp. The student was rotating on anesthesia, finds the tick, pulls it off, and the next picture is 4 hours later, the girl walking out of the ICU. It's one of those things, especially for the med students, people who are not necessarily going into derm, that, remembering the differential of Guillain-Barré. And that's Dermacentor variabilis, which is one that we have here. We've got a lot of amblyoma, we have Ixodes, we have Dermacentor here. Stick-tight flea, flat nose. It's a poultry flea. It has this big serrated lancinia, and that makes it stick tight, right, to the chicken or the human. And dogs in the southeast often have it. So, and again, it's fleas are disease vectors. So. Okay, what's this?
So, location, is that the back?
Probably like clavicle area.
Okay, clavicle, I see it now. So, shiny white, really thin papules. What an interesting location being on the trunk.
So differential.
So, like depigmenting, psoriasis alba. It doesn't look like TV because it's not really scaly.
So you're questioning TV, and they're often described as TV-like. It looks like there's hyperkeratosis here, flat-topped, light reflex, epidermodysplasia versiformis. With light protection, what's your lifespan? Normal, right? Without photoprotection, what's your lifespan? They die in their 20s of metastatic squam. So it's like xeroderma pigmentosum in terms of squamous cell carcinoma risk. Right, so, and photoprotection, just like in XP, is key. Okay, how about this?
Some erythematous polycyclic patch,
Yeah.
median extremity.
Yeah, so it extends up the proximal extremity, and every time the kid gets worked up or hot or has gone out to play, it shows up again on the proximal extremity. And it is kind of polycyclic or net-like, reticulated.
I mean, like the libido kind of comes to mind, but it's probably more vascular if it's...
Any in his school, there have been kids with slap cheek, red cheeks.
Okay, this is a parvovirus.
Yeah, parvo. So parvo, in the acute phase, you get the slap cheeks, right? In the chronic phase, you get the proximal reticulated erythema that kind of waxes and wanes, and every time you get overheated, it shows up again. Systemic complications to adults of parvo. Who's at risk of parvo? So pregnancy, so miscarriage is a risk. Arthritic syndrome is also something. Adults get the gloves and socks petechiae and can also get the arthritic syndrome. Who else is at risk? Any kid with any sickler? Anyone with spherocytosis, elliptocytosis. So parvo in everyone shuts down your marrow shuts down your red cell production for probably a couple weeks. If you have a normal 120-day lifespan of your red cells, you don't even see the dip. But what if you have a chronic hemolytic anemia? Then you get aplastic crisis, right? The mechanism for miscarriage is a aplastic crisis in that fetus, and the fetus can't survive the aplastic crisis. Right? So who's at risk? The sicklers and the pregnant teachers, right? Anyone who volunteers in the school who's pregnant. How long does this kid have to be banned from the classroom?
He's already
This
presented,
one is
right?
not infectious.
Once he has it, it's not infectious.
You are correct. Well done, Dr. Gathing. So, with the exception of the people with the chronic hemolytic anemia, so if this kid has elliptocytosis, he may still be shedding virus. So if you have a chronic hemolytic anemia, you can also be a chronic shedder. But evidence is strong that by the time you have the exanthem, including the slapped cheeks, you're no longer infectious. So who gets banned from the classroom? You don't know which kid is harboring it, right? So during the outbreak in the school, it's the pregnant teacher who needs to stay home, and the kid with sickle cell who needs to stay home and be on homebound instruction. Putting this kid on homebound instruction, and this goes on for months, the exanthem, doesn't accomplish anything because the kids who are infectious are still in the classroom and haven't presented with rash yet. So it's just a conversation with the school nurse. Is the teacher pregnant? Is this all through the school? Do you have sicklers, known sicklers in the classroom? Those are the ones at risk. Okay, what's that?
Pustular, so maybe ant bites.
Yeah, and that's pretty typical for fire ants, right? Those intensely itchy pustules. So that's one of the pictures in Andrews. That was my daughter when we had there was a big, huge meteor shower. So we went out into the hill country of Texas to see it. Didn't really see much of anything, but we all got horrible, because you're walking around in the dark, standing in fire ant mounds, and we come home all stung, and the neighbors are folding up their lawn chairs saying, "It was spectacular!" They were in their driveway. So, the reason they form these rosettes is it clamps on with its mandible, and then it pivots and stings. Right? So those little rosettes are really characteristic. I think this is the one we put in Andrews. Okay, what's this one? Coxsackie. Right, so this is your typical Coxsackie A16. They're oval erythematous macules that blister, reticular degeneration on path, tend to follow skin lines, often on the volar surface and sides of digits, right? How does A6 differ in presentation?
It's just more the atypical, isn't it? More generalized.
So more generalized and herpetiform groupings, right? So the eczema coxsackium that mimics eczema herpeticum is A6. Onychomedicis during the healing phase of A6. The other thing, when A6 first showed up in Hong Kong and East Asia, there was a significant death rate with it. Kids got really sick. And even now, there's a significant rate of hospitalization. So kids get sicker with A6 than they do with your typical A16, where they have, hand, foot, mouth, and butt, right, which is what it should be called. Okay, how about that?
Roots, vesicles on everything this face, like HSV.
Yeah, and you can see how they're umbilicated, right? So that's a very typical HSV presentation. You don't really know if it's one or two, but one still has a strong predilection for oropharyngeal and two for genital sites. Okay, how about that?
Got more of a scallop border than the HSV and immunocompromised patient.
Correct. So when you see this kind of ulcer with a rolled scalloped border, you are worried about underlying immunosuppression, right? We see it in patients with connective tissue disease, people chronically on prednisone, and people with cancer, and as presentation of HIV. right? And lymphoma, I guess that's a form of cancer. Right? So this guy, his nails never seem to bother him. He has widespread erythroderma. It wasn't until this happened that he came in. All of it's his retroperitoneal lymphoma, right? But his presentation was, one look at that's chronic ulcerative herpes. Why are you immunosuppressed? You have erythroderma. We start looking at causes of erythroderma and immunosuppression. And then Zank smear, you usually have a neutrophilic background. If there are no neutrophils, you probably don't have a good Zank smear. And then multinucleation, so a large ballooned keratinocyte, multinucleation, molding where they're flattened, and margination of chromatin. You can see it's bluer at the periphery of the nucleus, just like on histopath. Right? So margination, molding, and multinucleation. The sort of pattern that you might see in herpes gladiatorum, which is why wrestlers are screened for herpetic infection before they can wrestle. The residents are often involved in screening. At the regional championships last week, there was someone who kept insisting he had cut himself shaving. And the reply was, yeah, and you also got a pretty good cold sore there, and you're not going to wrestle, right? Because it does disqualify them from the meet because they put others at risk for ophthalmicus and all sorts of things because of the way the holds are done during wrestling. Ixodes ticks, we have a lot of them in the south. No festoons, right? So no festoons on the base. Inornate brown scutum. It has the basis, probably the biggest lookalike are the rhipocephalus brown dog ticks that carry spotted fever and Ehrlichia and Rocky Mountain, other spotted fevers like the rickettsial fevers in Europe, but also Rocky Mountain spotted fever versus this, which is Lyme and anaplasmosis and Babesia. The rhipocephalus ticks, the basis capituli or capillity looks like a hexagon with points going out the two sides, and Ixodes doesn't have that. If you flip them over, Ixodes has an anterior anal groove. So see the way this looks like a horseshoe? It's exactly the same on the back. So the anus is there, and the anal groove is anterior. Most other North American ticks have a posterior anal groove. So it's not that hard to walk through it. People do come in with ticks attached, and you get asked, what do they have to watch for? Well, what disease it carries, and what you can counsel them. Okay, what's that guy?
Owl pellet.
What?
Looks like an owl pellet.
Oh, like an owl pellet. Yes, an owl pellet with legs. So that's your woolly asp. That's the megalopyge caterpillars. They cause really bad stings. Anywhere you have live oak, you have them. Right? So you're trimming your tree and something falls on you and you get this horrible sting. That's woolly asp sting. And this is the characteristic for any caterpillar envenomation. They have these railroad tracks. So it can be hemorrhagic or erythematous, intensely painful, and the railroad tracks are because the hairs form rosettes around the body. And so you get a ring of hairs giving you a ring of hemorrhage. So it doesn't tell you which caterpillar, but that's very characteristic for some kind of caterpillar envenomation. The Lenomia caterpillars in South America are the ones that cause fatal hemorrhage. So it's very common to get local hemorrhage with caterpillar stings. Linomia caterpillars, if a bunch of them fall on you, it apparently happens with rubber and chicle workers, that they get a lot of stings at once, and you can have fatal hemorrhage, fatal systemic hemorrhage. Millipedes, the important thing is you get these arcuate-like burns on the skin that are hyperpigmented, and they're all symmetrical. It looks like someone has taken something and burnt you with an arc, and they crawl into the laundry. And so there's a question of child abuse if no one recognizes the characteristic shape of the burn. So, and there have been horrible cases where the child is taken into custody and things where the parents did nothing more than hang out the laundry. So you want to. There have also been cases. There was one awful case of vulvar cicatricial pemphigoid in a little girl, and the child was never seen by a dermatologist. A pediatrician testified that the injuries were characteristic of child abuse, and the father was convicted of child abuse. The conviction was not overturned until she continued to have the blistering and erosions and sores, and was finally diagnosed with cicatricial pemphigoid. But because of the law in the state, even when he was left out of prison, mom had left him because he was a sex offender who had attacked their daughter, or so she believed, and he still has to register as a sex offender because he was convicted. So even though it was overturned, he can't pick up his daughter at school, he can't go near the school. Just this is another child abuse scenario. We play an important role in recognizing patterns of skin disease, what is and is not sign of abuse. Recognize nits as sign of infection. Okay, how about this? We're coming down to the hour here. Yeah, oral hairy leukoplakia, which is associated with and EBV. Yeah, so it's an EBV manifestation in HIV. It usually is the lateral sides of the tongue, exaggeration of the papillae. Histologically, you can tell it from oral white sponge nevus because there's a basophilic stippling of the nuclei. Makes it easy to tell them apart. So oral hairy leukoplakia. Okay, how about that? Yeah, so it's a broad differential. It could be anything from a rip-roaring pityriasis rosea, viral exanthem, and in this case, this was all reactive papular urticaria to flea bites. This is the one from the James Bond movies, right? The thicker the tail, the more venomous the scorpion in general. Okay, what's that?
On the medial final brownish to red papules that coalesce into larger macules.
Anyone recognize it? Yeah, this is parvo in an adult. This is the purpuric gloves and socks. It's petechiae in a gloves and socks distribution. So it's recognizable as parvo. Head and body lice look pretty much the same. The body lice are known to carry a lot of disease like typhus, and trench fever, and and are an important cause of infectious endocarditis among the homeless in the U.S. And head lice, so far, not so much in terms of vector. Socotra, so-called book lice, they are, as it sounds like, decaying paper, decaying leaves, pet habitats, like it's in the gerbil cage in the classroom. The kids get them on them and then get treated with lice or for lice repeatedly. Important to recognize them because you got to identify the environmental source. They're not going to lay nits on the kids. And repeated permethrin treatment has been epidemiologically linked to leukemia risk. So you would prefer not to have needlessly treated a child again and again and again with permethrin. Sauroptes are a zoonotic mite related to scabies. It looks kind of like scabies that's been working out. And again, it's the key is you look for a zoonotic focus, right? They can get on you, but they don't live on you for a long time. The human flea, classic plague vector, it doesn't have combs, so unlike cat and dog fleas. Okay, what's that?
Looks like a wart with capillary hemorrhages.
Yep, exactly. So it looks like a wart, and we'll pick up again with that one next time. We are on 87, and we'll talk about treatment of common warts. Yes.
Just because like the pruritus is there and they were treated before like pruritus with the permethrin and then they eventually end up having leukemia.
It's a very good question. Association does not